300,000 people are now known to have died in India's second wave of coronavirus, with May likely to be the deadliest month so far. But the true death toll could be several times higher, especially in rural areas where the virus is now spreading. Access to healthcare there is almost non-existent, as our international correspondent Orla Girin found when she travelled to Bihar, one of the poorest areas in India.
Funeral pyres are now a prism for the pain of a nation. He is lost in grief for his mother, one of the latest victims of COVID-19 in the state of Bihar. With so many dead across India, cremation costs have soared. Some families here have been reduced to entrusting the bodies of their loved ones to the sacred waters of the Ganges. Prime Minister Narendra Modi, whose ratings are falling, has been remembering the dead with a show of emotion. But within hours, crocodile tears was trending on social media here. The full scale of India's tragedy may never be known. We crossed the Ganges to reach the vast hinterland. In rural areas like the village of Birpur, we found a landscape of neglect and untold stories. So can you tell me, are many families affected here?
Yes, many families affected here. Many people's death. Every home, many people get a fever and cough, but no test.
No social distancing either, and no masks in sight. This is the other India, not rising but left behind. People here say the living are barely counted, much less the dead. We've been told that 26 people have died here with symptoms of COVID-19 in the past month, but none of them were actually tested. That means they're not included in India's official death toll from the virus. Now, this is just one village, but you can multiply this across India. Take a look at the village health centre. Imagine having to rush here in an emergency. It's an empty shell, carefully padlocked. This neglect is not unusual in rural India. It takes 3 hours to get to a hospital. Many can't afford the journey. The village leader, Arun Kumar Rai, has lost neighbours and friends. He blames the Prime Minister.
मोदी जी कहते हैं कि अपने आत्मनिर्भर बनो, तो कोरोना के समय भी जनता को आत्मनिर्भर पर छोड़ दिए मोदी जी, जिसका नतीजा है कि इस पोजीशन पर महामारी गया। व्यवस्था यदि उस तरह के किया जाता, कहीं हॉस्पिटल बनाया जाता, तब इस तरह का चपेट में नहीं पड़ता। चारों तरफ से फेल है, कहीं कुछ नहीं हो और लोग त्राहिमामी करके मर रहे हैं महामारी में।
When we returned to Birpur for a second day, health workers had been dispatched to the village. A local source told us the visit was a token gesture because we had been on the ground. Hello. Hi, we are from BBC News. Health worker Malti Kumari finally had some vaccines.
प्लान था 50 आदमी के, लेकिन अभी तक एक भी नहीं जुटे हैं ना। लोग नहीं आ रहे हैं कि हमको बुखार लग जाता है, वैक्सीन लेने से मार रहा है, जान के ये लोग मार रहे हैं।
So she waited in vain. There is vaccine hesitancy in the village, but in much of the country there's no vaccine to be had. COVID has cut across India like a scythe, bringing anguish for the living and indignity for the dying. And for the Prime Minister, the accusation of failing his people.